results, obviously once you have done your methodology and you have conducted the statistical analysis, the next thing that you will are going to get is your results. Let's discuss how to write results. Sorry. So many reviewers or many serious researchers, they consider results as the core of the paper. As I just mentioned, introduction is just background. Discussion is just like comparison and contrast of your research with the published data and material. And methodology is actually that method by which you try to find an answer. Now, result is actually that answer that you get after doing all this research. So that's why some people consider it as a core of the paper, and they actually give more importance to the result instead of giving importance to the introduction and discussion section. So how do you write results? You write results in form of text. You also include tables, figures, or both. Uh, the important thing while creating tables and figures is, if you're writing for a research journal, you need to read the instruction to author, and it should be very much clear that how much is the limit for tables and figures. So many a time what I have seen that colleagues, they are writing a dissertation, they complete their dissertation, they finalize their dissertation, it gets accepted, and they have like put in like 20 graphs and 15 figures. And whenever they are trying to convert that dissertation into a research article, they simply copy paste all of the tables and figures in that research article. It is absolutely not allowed. Please read the instruction to author of the journal or the instruction for dissertation and thesis of your particular university, that how many tables and figures you are allowed to use. Number one. Number two, there's a common trend that people do duplication or even triplication of data. What do I mean by that? Duplication or triplication means to present the same data in different forms. So हमारे यहाँ लोग क्या करते हैं, कई दफा मैंने देखा है डिसर्टेशन में सबसे पहले टेक्स्ट में डिटेल में सारे डेमोग्राफिक्स एक्सप्लेन कर दिए, इतने मेल इतने फीमेल, ये एज ग्रुप्स हैं, ये प्रॉब्लम है, ये इशू है, इतने मैरिड इतने अनमैरिड, एजुकेशनल स्टेटस ये है. उसके बाद उसी चीज को वो कन्वर्ट कर देते हैं फिगर में, और उसके बाद सेम उसी चीज का वो बना देते हैं टेबल. Please do not do that. Duplication and triplication of data is absolutely not allowed, and it really creates a bad impression. It shows that the researcher or the student or the author is simply trying to fill in the gaps by doing this duplication or triplication. And another principle specifically in case of research articles, because the space is very much limited in case of research article in the biomedical journals. So if you can explain a concept, if you can explain a result, if you can explain anything in 3 lines or less, please do not make a table out of that. ये एक मोटा सा प्रिंसिपल आप समझ लीजिए कि अगर आप 3 लाइनों में कोई चीज एक्सप्लेन कर सकते हैं, कोई रिजल्ट बता सकते हैं, कोई रिजल्ट डिस्कस कर सकते हैं, डिस्प्ले कर सकते हैं, प्लीज उसका टेबल या फिगर मत बनाइए. टेबल एंड फिगर दे टेक अप लॉट ऑफ स्पेस, और आपको अंदाजा नहीं है कि द एडिटर दे रियली आर अनॉयड once they have to create extra space for these kind of tables. So please remember that. The second thing you need to understand regarding results is you should only summarize the important findings rather than providing data in great details. Again, I know whenever you do research, you get a lot of data. Some of that data makes sense, and that is directly related to the hypothesis or the research that you are conducting. But some of the data does not make sense, or it is secondary data, or it does not add any meanings to the research that you are doing. So if that is the case, please do not try to put in every piece of data in your dissertation or research article. For example, again, sometimes if it is appropriate to simply describe the age groups, like this disease was more common in the children less than 18 as compared to adults between 20 to 65, and it was reported the most in elderly people more than 65 years of age. So if you can probably explain it in this way, then it's important that you do not like start describing that the incidence of this disease in children from 1 to 10 years was this, from 11 to 20 was this, from 21 to 30 was this. It won't make any sense at all. So please, you should summarize the results instead of providing each piece of data in great detail. And the second important thing you need to consider is you simply describe your results and you move forward to the next section, that is discussion. You don't start describing or discussing or commenting upon your results in the result section. रिजल्ट सेक्शन में आपने सिर्फ रिजल्ट्स बयान करने हैं और आगे चल पड़ना है. please do not start commenting and discussing your results in the results section. Uski jagah kaun si hai? Discussion. Now, what do you write in the result section? Obviously, first of all, you start off with how many patient or participant were recruited for this study, right? And what was your dropout rate? For example, if you're doing a randomized control trial or a clinical interventional trial, so there's a possibility that you recruited two groups of 50 patients each, but at the end of 6 months, you were left with only 38 patients in one group and 41 patients in another group. So you need to clearly mention the timeline in the results section, and then you have to explain clearly why there was a dropout, and then you have to, like, you might want to make a chart out of it, or you might want to make a figure out of it, that why the patient were dropped out, or why did he drop out, whether it was because of complication, it was because of a side effect of the treatment, or the patient simply stopped coming. If you're doing a cross-sectional survey, you have to mention in the methodology that, like, the survey was sent to 1000 participants via online or face-to-face interviews, and then you have to mention the response rate. That, for example, 680 surveys were received, which means that the response rate was 68%, out of which 80 surveys were discarded because they were either incomplete or they were double entries, and finally 600 surveys were finally analyzed for the statistical analysis. तो ये तमाम बातें आपने इसमें बयान करनी होती है. Then this is the place where you would describe the detailed demographics of your subjects or the population that you are studying. And again, you describe only the demographic that makes sense or are directly related to the objectives of your study. So the normal demographic that we usually use, they include age, gender, educational status, marital status, and the disease status of the person. So and the employment status. So whatever demographics are important, you mention them. In some case, you have to go for the detailed demographics and detailed measurements, like, for example, BMI, or for example, their psychological status, or for example, their height, their weight, and so many other things. So whatever you have decided, now is a place where you start describing them. Then again, you have to mention the result of your intervention, whatever you have done, whether you have done a physical therapy trial, you have done a drug trial, or you have done a device trial. So there will be certain outcomes. So for example, in case of rehab, we focus mostly on functional outcome, but in other subjects, they might want to focus only on the result of intervention. Then many interventions, they might result in known or unknown side effect. If this is the case, you have to clearly mention that how many patients they developed side effects, and how many patients they stopped the intervention or they stopped participating in the research and trial because of the side effects. And sometimes different drugs or different intervention, they might result in complications, both known and unknown. Again, if that's the case, please mention them clearly in the result section. And outcome mean, for example, in rehab, we go for the functional outcome. So for example, you're doing a trial of physical therapy in stroke, and you want to assess that how the patient are going to get better. And your functional outcome was that you were doing the tug test, timed up and go test, or probably 6-meter walk test. So that is your outcome. And now you explain the outcome of the patient in these two parameters. So this is how you write the result section. And again, sometimes, especially in case of dissertation, because you have a lot of data to present, so it's important that if there's a unique finding, there's a very important finding, you explain or you describe that finding upfront. So important finding को आखिर के लिए मत रखिए, एक logical sequence में चलिए, और जो important finding है उसको पहले बयान करने की कोशिश कीजिए. The common mistake that people do in result section include, number one, illogical sequence of data presentation. So the usual logical sequence is that first of all, you describe the demographics, then you describe the interventions, and then you describe the outcome of that intervention, and then probably complication and side effects. But if you start off with the complication, then you start describing the demographics and then intervention, it won't make any sense. So please remember, ये छोटी मोटी चीजें आपके articles को क्या नाम है reject करवा देती हैं. And these small things do matter a lot, whether you're writing a dissertation or whether you're writing an article. So small things do matter. Repetition of data, I just told you, please do not duplicate and triplicate your data while you are writing a dissertation or article, and do not try to represent your data first in the text form, then in the figure form, and then in the table form. Don't do that. It's not allowed. Again, misplaced information between material and method and result section. Many times people make mistake that they start describing the details of statistical analysis in the result section. at the start of the result section. No, it's not appropriate, because statistical analysis itself is a methodology. It is a method by which you get results. So you have to explain and you have to put the statistical analysis in the methodology section. So don't do these kind of mistakes. Overuse and abuse of tables and figure, again, it is related both to the duplication and triplication of data. And one example I'm going to tell you later on. And do not please write your conclusions in the result section, because sometimes people are tempted that they present their results and they are tempted to write their conclusion right there. Don't do that. In result, you only present the result. You do not comment on them. You do not discuss them. You simply present and you move forward. So this was all about the result section.